Cognitive behavioral therapy.
Cognitive behavioral therapy, CBT, is a psychosocial intervention 1-2 that aims to improve mental health. 3. CBT focuses on challenging and changing cognitive distortions, e.g. thoughts, beliefs, and attitudes, and behaviors, improving emotional regulation 2-4 and the development of personal coping strategies that target solving current problems. It was originally designed to treat depression, but its uses have been expanded to include treatment of a number of mental health conditions, including anxiety 5-6 alcohol and drug use problems, marital problems, and eating disorders. 7-8 CBT includes a number of cognitive or behavior psychotherapies that treat defined psychopathologies using evidence-based techniques and strategies. 9-10-11 CBT is based on the combination of the basic principles from behavioral and cognitive psychology. 2. It is different from historical approaches to psychotherapy, such as the psychoanalytic approach where the therapist looks for the unconscious meaning behind the behaviors and then formulates a diagnosis. Instead, CBT is a problem-focused and action-oriented form of therapy, meaning it is used to treat specific problems related to a diagnosed mental disorder. The therapist's role is to assist the client in finding and practicing effective strategies to address the identified goals and alleviate symptoms of the disorder. 12 CBT is based on the belief that thought distortions and maladaptive behaviors play a role in the development and maintenance of many psychological disorders. 3 and that symptoms and associated distress can be reduced by teaching new information processing skills and coping mechanisms. 1-12-13 When compared to psychoactive medications, review studies have found CBT alone to be as effective for treating less severe forms of depression. 14 Anxiety, post-traumatic stress disorder, PTSD, tics. 15 Substance use disorders, eating disorders, and borderline personality disorder. 16 Some research suggests that CBT is most effective when combined with medication for treating mental disorders such as major depressive disorder. 17 In addition, CBT is recommended as the first line of treatment for the majority of psychological disorders in children and adolescents, including aggression and conduct disorder. 4 Researchers have found that other bona fide therapeutic interventions were equally effective for treating certain conditions in adults. 18-19 Along with interpersonal psychotherapy, IPT, CBT is recommended in treatment guidelines as a psychosocial treatment of choice. 120 Cognitive behavioral therapy, CBT, is a psychosocial intervention 1-2 that aims to improve mental health. 3 CBT focuses on challenging and changing cognitive distortions, e.g. thoughts, beliefs, and attitudes, and behaviors, improving emotional regulation 2-4 and the development of personal coping strategies that target solving current problems. It was originally designed to treat depression, but its uses have been expanded to include treatment of a number of mental health conditions, including anxiety 5-6 alcohol and drug use problems, marital problems, and eating disorders. 7-8 CBT includes a number of cognitive or behavior psychotherapies that treat defined psychopathologies using evidence-based techniques and strategies. 9-10-11 CBT is based on the combination of the basic principles from behavioral and cognitive psychology. 2 It is different from historical approaches to psychotherapy, such as the psychoanalytic approach where the therapist looks for the unconscious meaning behind the behaviors and then formulates a diagnosis. Instead, CBT is a problem-focused and action-oriented form of therapy, meaning it is used to treat specific problems related to a diagnosed mental disorder. The therapist's role is to assist the client in finding and practicing effective strategies to address the identified goals and alleviate symptoms of the disorder. 12 CBT is based on the belief that thought distortions and maladaptive behaviors play a role in the development and maintenance of many psychological disorders. 3 and that symptoms and associated distress can be reduced by teaching new information processing skills and coping mechanisms. 1-12-13 When compared to psychoactive medications, review studies have found CBT alone to be as effective for treating less severe forms of depression. 14 Anxiety, post-traumatic stress disorder, PTSD, takes 15 substance use disorders, eating disorders, and borderline personality disorder. 16 Some research suggests that CBT is most effective when combined with medication for treating mental disorders such as major depressive disorder. 17 In addition, CBT is recommended as the first line of treatment for the majority of psychological disorders in children and adolescents, including aggression and conduct disorder. 4 Researchers have found that other bona fide therapeutic interventions were equally effective for treating certain conditions in adults. 19 Along with interpersonal psychotherapy, IPT, CBT is recommended in treatment guidelines as a psychosocial treatment of choice. 120.
Behavior therapy roots. John B. Watson. The modern roots of CBT can be traced to the development of behavior therapy in the early 20th century, the development of cognitive therapy in the 1960s, and the subsequent merging of the two. Groundbreaking work of behaviorism began with John B. Watson and Rosalie Rayner's studies of conditioning in 1920. 26. Behaviorally centered therapeutic approaches appeared as early as 1924-27, with Mary Cover Jones's work dedicated to the unlearning of fears in children. 28. These were the antecedents of the development of Joseph Wolpe's behavioral therapy in the 1950s. 26. It was the work of Wolpe and Watson, which was based on Ivan Pavlov's work on learning and conditioning, that influenced Hans Eysenck and Arnold Lazarus to develop new behavioral therapy techniques based on classical conditioning. 26-29. During the 1950s and 1960s, behavioral therapy became widely utilized by researchers in the United States, the United Kingdom, and South Africa, who were inspired by the behaviorist learning theory of Ivan Pavlov, John B. Watson, and Clark L. Hull. 27. In Britain, Joseph Wolpe, who applied the findings of animal experiments to his method of systematic desensitization. 26. Applied behavioral research to the treatment of neurotic disorders. Wolpe's therapeutic efforts were precursors to today's fear reduction techniques. 27. British psychologist Hans Eysenck presented behavior therapy as a constructive alternative. 27-30. At the same time as Eysenck's work, B. F. Skinner and his associates were beginning to have an impact with their work on operant conditioning. 26-29. Skinner's work was referred to as radical behaviorism and avoided anything related to cognition. 26. However, Julian Rotter, in 1954, and Albert Bandura, in 1969, contributed behavior therapy with their respective work on social learning theory, by demonstrating the effects of cognition on learning and behavior modification. 26-29. The work of the Australian Claire Weekes dealing with anxiety disorders in the 1960s was also seen as a prototype of behavior therapy. 31. The emphasis on behavioral factors constituted the first wave of CBT, cognitive therapy roots. One of the first therapists to address cognition in psychotherapy was Alfred Adler with his notion of basic mistakes and how they contributed to creation of unhealthy or useless behavioral and life goals. 33. Adler's work influenced the work of Albert Ellis, 33, who developed the earliest cognitive-based psychotherapy, known today as rational emotive behavior therapy, or REBT. 34. Ellis also credits Abraham Lowe as a founder of cognitive behavioral therapy. 35. Around the same time that rational emotive therapy, as it was known then, was being developed, Aaron T. Beck was conducting free association sessions in his psychoanalytic practice. 36. During these sessions, Beck noticed that thoughts were not as unconscious as Freud had previously theorized, and that certain types of thinking may be the culprits of emotional distress. 36. It was from this hypothesis that Beck developed cognitive therapy, and called these thoughts automatic thoughts. 36. Beck has been referred to as the father of cognitive behavioral therapy. 37. It was these two therapies, rational emotive therapy, and cognitive therapy, that started the second wave of CBT, which was the emphasis on cognitive factors. Although the early behavioral approaches were successful in many of the neurotic disorders, they had little success in treating depression. 26-27-38. Behaviorism was also losing in popularity due to the cognitive revolution. The therapeutic approaches of Albert Ellis and Aaron T. Beck gained popularity among behavior therapists, despite the earlier behaviorist rejection of mentalistic concepts like thoughts and cognitions. 26. Both of these systems included behavioral elements and interventions and primarily concentrated on problems in the present. In initial studies, cognitive therapy was often contrasted with behavioral treatments to see which was most effective. During the 1980s and 1990s, cognitive and behavioral techniques were merged into cognitive behavioral therapy. Pivotal to this merging was the successful development of treatments for panic disorder by David M. Clark in the UK and David H. Barlow in the US. 27. Over time, cognitive behavior therapy came to be known not only as a therapy, but as an umbrella term for all cognitive-based psychotherapies. 26. These therapies include, but are not limited to, rational emotive therapy, REBT, cognitive therapy, acceptance and commitment therapy, dialectical behavior therapy, metacognitive therapy, metacognitive training, reality therapy/choice theory, cognitive processing therapy, EMDR, and multimodal therapy. 26. All of these therapies are a blending of cognitive and behavior-based elements. This blending of theoretical and technical foundations from both behavior and cognitive therapies constituted the third wave of CBT. 39-32. The most prominent therapies of this third wave are dialectical behavior therapy and acceptance and commitment therapy. 32. Despite the increasing popularity of third-wave treatment approaches, reviews of studies reveal there may be no difference in the effectiveness compared with non-third-wave CBT for the treatment of depression. 40. Mainstream cognitive behavioral therapy assumes that changing maladaptive thinking leads to change in behavior and effect. 41. But recent variants emphasize changes in one's relationship to maladaptive thinking rather than changes in thinking itself. 42. The goal of cognitive behavioral therapy is not to diagnose a person with a particular disease, but to look at the person as a whole and decide what can be altered. Cognitive distortions. Therapists or computer-based programs use CBT techniques to help people challenge their patterns and beliefs and replace errors in thinking, known as cognitive distortions, such as overgeneralizing, magnifying negatives, minimizing positives and catastrophizing with more realistic and effective thoughts, thus decreasing emotional distress and self-defeating behavior. 41. Cognitive distortions can be either a pseudo-discrimination belief or an overgeneralization of something. 43. CBT techniques may also be used to help individuals take a more open, mindful, and aware posture toward cognitive distortions so as to diminish their impact. 42. Skills. Mainstream CBT helps individuals replace maladaptive coping skills, cognitions, emotions and behaviors with more adaptive ones. 44. By challenging an individual's way of thinking and the way that they react to certain habits or behaviors. 45. But there is still controversy about the degree to which these traditional cognitive elements account for the effects seen with CBT over and above the earlier behavioral elements such as exposure and skills training. 46. Phases in therapy. CBT can be seen as having 6 phases. 44. Assessment or psychological assessment. Reconceptualization. Skills acquisition. Skills consolidation and application training. Generalization and maintenance. Post-treatment assessment follow-up. These steps are based on a system created by Canfor and Saslow. 47. After identifying the behaviors that need changing, whether they be in excess or deficit, and treatment has occurred, the psychologist must identify whether or not the intervention succeeded. For example, if the goal was to decrease the behavior, then there should be a decrease relative to the baseline. If the critical behavior remains at or above the baseline, then the intervention has failed. 47. The steps in the assessment phase include: Step 1. Identify critical behaviors. Step 2. Determine whether critical behaviors are excesses or deficits. Step 3. Evaluate critical behaviors for frequency, duration, or intensity. Obtain a baseline. Step 4. If excess, attempt to decrease frequency, duration, or intensity of behaviors. If deficits, attempt to increase behaviors. 48. The reconceptualization phase makes up much of the cognitive portion of CBT. 44. A summary of modern CBT approaches is given by Hoffman. Delivery protocols. There are different protocols for delivering cognitive behavioral therapy, with important similarities among them. 50. Use of the term CBT may refer to different interventions, including self-instructions, for example distraction, imagery, motivational self-talk, relaxation and/or biofeedback, development of adaptive coping strategies, for example minimizing negative or self-defeating thoughts, changing maladaptive beliefs about pain, and goal setting. 44. Treatment is sometimes manualized, with brief, direct, and time-limited treatments for individual psychological disorders that are specific technique-driven. 51. CBT is used in both individual and group settings, and the techniques are often adapted for self-help applications. Some clinicians and researchers are cognitively oriented, for example cognitive restructuring, while others are more behaviorally oriented, for example in vivo exposure therapy. Interventions such as imaginal exposure therapy combine both approaches. 52-53. Related techniques. CBT may be delivered in conjunction with a variety of diverse but related techniques such as exposure therapy, stress inoculation, cognitive processing therapy, cognitive therapy, metacognitive training, relaxation training, dialectical behavior therapy, and acceptance and commitment therapy. 54-55. Some practitioners promote a form of mindful cognitive therapy which includes a greater emphasis on self-awareness as part of the therapeutic process. 56. In adults, CBT has been shown to have effectiveness and a role in the treatment plans for anxiety disorders. 57-58. Body dysmorphic disorder. 59. Depression. 60-61. Eating disorders. 62. Chronic low back pain. 44. Personality disorders. 63. Psychosis. 64. Schizophrenia. 65. Substance use disorders. 66. In the adjustment, depression, and anxiety associated with fibromyalgia. 41. And with post-spinal cord injuries. 67. In children or adolescents, CBT is an effective part of treatment plans for anxiety disorders. 68. Body dysmorphic disorder. 69. Depression and suicidality. 70. Eating disorders and obesity. 71. Obsessive-compulsive disorder, OCD. 72. And post-traumatic stress disorder. 73. As well as tic disorders, trichotillomania, and other repetitive behavior disorders. 74. CBT-SP, an adaptation of CBT for suicide prevention, SP, was specifically designed for treating youths who are severely depressed and who have recently attempted suicide within the past 90 days, and was found to be effective, feasible, and acceptable. 75. CBT has also been shown to be effective for post-traumatic stress disorder in very young children, 3 to 6 years of age. 76. Reviews found low-quality evidence that CBT may be more effective than other psychotherapies in reducing symptoms of post-traumatic stress disorder in children and adolescents. 77. CBT has also been applied to a variety of childhood disorders, 78, including depressive disorders and various anxiety disorders. CBT combined with hypnosis and distraction reduces self-reported pain in children. 79. Cochrane reviews have found no evidence that CBT is effective for tinnitus, although there appears to be an effect on management of associated depression and quality of life in this condition. 80. Other recent Cochrane reviews found no convincing evidence that CBT training helps foster care providers manage difficult behaviors in the youths under their care. 81. Nor was it helpful in treating people who abuse their intimate partners. 82. According to a 2004 review by INSERM of 3 methods, cognitive behavioral therapy was either proven or presumed to be an effective therapy on several specific mental disorders. 83. According to the study, CBT was effective at treating schizophrenia, depression, bipolar disorder, panic disorder, post-traumatic stress, anxiety disorders, bulimia, anorexia, personality disorders and alcohol dependency. 83. According to a 2004 review by INSERM of 3 methods, cognitive behavioral therapy was either proven or presumed to be an effective therapy on several specific mental disorders. 83. According to the study, CBT was effective at treating schizophrenia, depression, bipolar disorder, panic disorder, post-traumatic stress, anxiety disorders, bulimia, anorexia, personality disorders and alcohol dependency. 83. Some meta-analyses find CBT more effective than psychodynamic therapy and equal to other therapies in treating anxiety and depression. 84-85. Computerized CBT, CCBT, has been proven to be effective by randomized controlled and other trials in treating depression and anxiety disorders, 58, 61, 86, 87, 88, 89, including children, 90, as well as insomnia. 91. Some research has found similar effectiveness to an intervention of informational websites and weekly telephone calls. 92-93, CCBT was found to be equally effective as face-to-face CBT in adolescent anxiety 94, and insomnia. 91. Criticism of CBT sometimes focuses on implementations, such as the UKI Apt, which may result initially in low-quality therapy being offered by poorly trained practitioners. 95-96, however, evidence supports the effectiveness of CBT for anxiety and depression. 88. Acceptance and commitment therapy, ACT, is a specialist branch of CBT, sometimes referred to as contextual CBT. 97. ACT uses mindfulness and acceptance interventions and has been found to have a greater longevity in therapeutic outcomes. In a study with anxiety, CBT and ACT improved similarly across all outcomes from pre to post-treatment. However, during a 12-month follow-up, ACT proved to be more effective, showing that it is a highly viable lasting treatment model for anxiety disorders. 98. Evidence suggests that the addition of hypnotherapy as an adjunct to CBT improves treatment efficacy for a variety of clinical issues. 99-100-101. Emerging evidence suggests a possible role for CBT in the treatment of attention deficit hyperactivity disorder, ADHD. 103. Hypochondriasis. 104. Coping with the impact of multiple sclerosis. 105. Sleep disturbances related to aging. 106. Dysmenorrhea. 107, and bipolar disorder, 108, but more study is needed and results should be interpreted with caution. CBT can have a therapeutic effects on easing symptoms of anxiety and depression in people with Alzheimer's disease. 109. CBT has been studied as an aid in the treatment of anxiety associated with stuttering. Initial studies have shown CBT to be effective in reducing social anxiety in adults who stutter, 110, but not in reducing stuttering frequency. 111-112. In the case of people with metastatic breast cancer, data is limited, but CBT and other psychosocial interventions might help with psychological outcomes and pain management. 113. There is some evidence that CBT is superior in the long term to benzodiazepines and the non-benzodiazepines in the treatment and management of insomnia. 114. CBT has been shown to be moderately effective for treating chronic fatigue syndrome. 115. In the United Kingdom, the National Institute for Health and Care Excellence, NICE, recommends CBT in the treatment plans for a number of mental health difficulties, including post-traumatic stress disorder, obsessive-compulsive disorder, OCD, bulimia nervosa, and clinical depression. 116. Depression. Cognitive behavioral therapy has been shown as an effective treatment for clinical depression. 60. The American Psychiatric Association Practice Guidelines, April 2000, indicated that, among psychotherapeutic approaches, cognitive behavioral therapy and interpersonal psychotherapy had the best documented efficacy for treatment of major depressive disorder. 117 page needed. One etiological theory of depression is Aaron T. Beck's cognitive theory of depression. His theory states that depressed people think the way they do because their thinking is biased towards negative interpretations. According to this theory, depressed people acquire a negative schema of the world in childhood and adolescence as an effect of stressful life events, and the negative schema is activated later in life when the person encounters similar situations. 118. Beck also described a negative cognitive triad. The cognitive triad is made up of the depressed individual's negative evaluations of themselves, the world, and the future. Beck suggested that these negative evaluations derive from the negative schemata and cognitive biases of the person. According to this theory, depressed people have views such as "I never do a good job," "it is impossible to have a good day," and "things will never get better." A negative schema helps give rise to the cognitive bias, and the cognitive bias helps fuel the negative schema. Beck further proposed that depressed people often have the following cognitive biases: arbitrary inference, selective abstraction, overgeneralization, magnification, and minimization. These cognitive biases are quick to make negative, generalized, and personal inferences of the self, thus fueling the negative schema. 118. A 2001 meta-analysis comparing CBT and psychodynamic psychotherapy suggested the approaches were equally effective in the short term. 119. In contrast, a 2013 meta-analysis suggested that CBT, interpersonal therapy, and problem-solving therapy outperformed psychodynamic psychotherapy and behavioral activation in the treatment of depression. 20.